Hello, it's Miss Heather, piano and voice teacher here at Conservatory of the Ozarks. I'm here today with Q, and I'm going to show these vocal tract stretches. And I apologize in advance, these are really strange things to do, but I promise they're all real. And I'm going to just move this out of the way. And also, like, pretty expensive to learn about. In my experience, at least, I learned these in speech therapy, most of them. So the top one on the chart is called the hyoid pinch. You have a hyoid bone that's part of your vocal tract. It's actually the only bone in the whole body that is not connected to like another bone, and it's what they check if you've been strangled to death. If the hyoid bone is broken, then they know you've been strangled to death.
Interesting. Wow.
Yeah. Nothing to do with voice, but it maybe will help you remember. So if you feel here, like you can feel some bumps, some ridges, and like if you move your finger around and you're phonating, you'll hear like, ugh. So we want to pinch the skin right in front of that and just gently pull and hold for a few seconds. While you do these, try to notice what you're feeling. I can feel on the inside of my ears and on the inside of my larynx, I can feel like these little like unwinding feelings. You might not feel, but maybe since you're a massage therapist, you might be more in tune with your body than most people, but it took me a while to really like observe and label the sensations. And you can like move around and pinch different spots in that same area and hold.
I do tend to do this when I'm sick. I'm just feeling this area.
That's probably good. Okay. Anterior cervical laryngeal massage / stretch. This is a weird one too. These are all weird. So here you can kind of feel this like little ridge between this and this muscle and the trachea. And you can gently, you got to be really gentle with these, slide your fingers between, and we're going to try to like get behind the larynx and scoop it forward very gently. It's like a stretch, so it shouldn't be like a sharp pain, but like a gentle, I mean, a stretch is kind of an intense feeling sometimes, but not painful. And like pull forward.
Actually feels really good.
Yeah, they should feel good. Oh, and if you feel throbbing under your fingertips from your artery, then readjust so you don't cut off your blood supply. And then just switch to the other side. And I'll just do like probably one repetition of each of these with you. You can kind of see how that serves you for the rest of the day, but you can do more than one once you kind of know what you can tolerate and how much is helpful for you. And then, you know, there are two types of stretches, isometric or repetitive. So like isometric is where you hold, repetitive is where you're like repeating the same movement over and over. So this is the isometric laryngeal slide. So it's like we're gonna find both of those little spots. We just put one at a time, our hands behind like this. And you can do it like this, or you can do it like this, but we want to grab the whole thing, and we're going to slide the larynx over to one side and hold, and then we'll go to the other side. Hold. You don't really have to grip on the side you're moving toward, but you can switch. And then same thing. This is the one where you have to grip a little bit more. The repetitive one, so we'll go back and forth gently. You can do like this. Or this. And yes, no, maybe. So yes, this is a repetitive one, so you go yes. I usually count to 10. Trying to only move your neck mainly. You feel a stretch. No, chin to shoulder. And maybe here to shoulder. Ooh, you got a crack.
Crack my neck.
This one always feels good.
Yeah.
And then yes, no, maybe isometric stretch. So you can gently place your hands on the base of your skull. And so it's like a thought of up and over and just like gentle pressure so you can feel your spine curling a little farther forward, a little farther forward. And then no, same, the thought of up, like you're grabbing your ear, pulling up and over, and make sure this hand is dangling freely, and you can even like draw figure eights with that hand if you want. So not just over, but also up.
Oh, okay.
Yeah. So obviously stretch here. In the, I think it's called the sternocleidomastoid muscle. You probably know better than I do.
And the scale line right there. I can feel it.
Good. And then we can switch. Yeah, knowing the names of all of the muscles and stuff was not part of my training, so I just like have researched that independently. So who knows if all of my terminology is correct?
It's pretty good.
Thank you, thank you. I've practiced pronouncing those long words.
Yeah.
They're so interesting how, like, you can hear in the word the definition of the word.
Right. Just take a word
It's
apart
helpful.
and put it together as what it came from.
Yeah, it's like pretty fascinating. I wish that was part of my training, my official training. Then diagonal glancing, that is where it's kind of like what we were doing before, but to the side this way, diagonally instead of straight up and down. And then other way. And okay, so this is specifically for the sternocleidomastoid muscle. So ideally, you would have somebody do it to you, and you would sit, and I would apply like, oops, sorry, that's your hair. I would apply like a decent amount of pressure, like trying to pull these two apart.
That one always feels good.
But this is the best I can find to do on your own. You can put your own hand on your shoulder, up and over with your neck, and just try to like gently apply pressure to your shoulder. Not quite as good as having someone else.
So we have massage therapists.
Yeah. Oh. I'm so excited. And I can do your other side for you. I'm so excited for Saturday. Have one of your staff work out all of my problems.
Oh, it feels so good.
Yeah. And then you can try to do it yourself this way. And so arm circles, this, you want to brace your palm like this and draw little circles. Keep your elbow straight, and then we'll come up, 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 till we're all the way up. And then, you know, you can make bigger circles, and you can also switch directions and experiment with getting the big circles and the little circles in both directions in like every part. And switch to the other. This one, only the first time the effect was the strongest, but ooh, the first time I did this, it like blew my mind. I don't know, like really. This, I think, the yes, no, maybe, and I think these stretches I got from like kind of a physical therapy focused chiropractor on YouTube, maybe, originally. These stretches are not all from the same source, so.
You just piece them together and fix your own.
Yeah, the ones that were the most helpful for me are the ones I've kind of put on this chart. And then shoulder roll, I'm sure you've seen before. So like if you had a pencil and you're trying to draw a circle with your shoulders. In college, my voice teacher, Mrs. Ruffin, would call this self-massage. It kind of does feel like that. And then opposite direction. Okay, and then we did these last time, so I'll skip to these, and then if you want to do these at the end, we can do those again, but that way if we run out of time, you've seen all of them. So the external TMJ stretch is, let's see, this one, so you can put your finger, if you like open your mouth, you can feel a little cave open up right in front of this. Oh, I forget what the name of this thing is always, this little thing on your ear.
Not too sure.
And you can find it on both sides. And then gently kind of try to bring your fingertips closer and closer together. You can kind of hold. Just like applying more pressure as you feel the tissues release. So this is, of course, stretching the outside of the temporal mandibular joint, which so many people have TMJ dysfunction, of course. So that's the outside from the finger on the inside of the mouth that we did last time. And then this, you can stack your hands for the jaw stretch. So this jaw hold. So tip of the tongue pressed against the roof of the mouth, right behind the upper teeth, should both help ensure you don't put too much pressure and open too far, and also can kind of support your jaw being able to open freely, I guess. Edvard Munch vibes, like the Scream, you know. Masseter stretch, so you make a fist, and with your proximal joints, grit your teeth, and you can feel your masseter muscles stick out underneath your cheekbones. Push in, and this one to me is pretty painful, and apply a great deal of pressure as you slide it downward under your jaw. This is likely to mess up foundation if you wear foundation, so sometimes people refuse to do this one in the lesson, but this is, I love doing this one if I'm putting on like serum on my face, because your like knuckles really slide easily, like a massage oil. I'm sure you have better technique than I do for this. I'm like seeing how you kind of can rub. Ooh, this one does feel good though.
It does. I was thinking to do a gua sha video eventually too. So this is actually majorly involved with gua sha.
I've watched a couple.
It can give your face a lip too.
Ooh.
Pretty concept.
I tried gua sha and I had that at occupational therapy for my hand and wrist pain from playing piano, but it only increased my mobility. I didn't get a reduction in pain, and I didn't notice a difference in my face, so maybe I need like a live tutorial from someone.
Yeah.
Because I've seen other people's before and afters, and I was
really
like, wow.
Lifting up your face and getting the fluid on your face. You know, if you had the night before you ate some very salty dinner, and then the next day you woke up and like, oh, my face is like, that would really help out draining the fluid.
Yeah, I would. I tried it for a while, and I just didn't have that much to drink. It is like you want to keep drinking as you do these. Okay, and then the goldfish stretch is the only other one I haven't showed yet. So this is the same. You put the finger in the cave, tongue up, and then another finger on your chin, and just apply gentle pressure to the chin. So you're pushing in and down at the same time, and then we'll switch sides. How long you should hold these for is a little unclear to me because I've heard a lot of different numbers. One physical therapist told me you shouldn't hold any stretch longer than 8 seconds because after 8 seconds you begin to cut off the blood flow. And then other people I've seen have said do like 30 seconds for each hold because you're not going to get the full release till you've held it for 30 seconds. So I guess just experiment and find.
It depends on the area and how comfortable you are with the stretch, you know. Like if this is a stretch that you don't do very often and this is something that your body doesn't normally go, then definitely a shorter time.
That makes sense. Yeah. So I just kind of like experiment and see how I feel. I haven't noticed like the blood flow thing. I'm not saying that doesn't happen, but I haven't noticed that if I go longer than 8 seconds that the blood flow being cut off has been a big issue, but it's not my field. That, you know, it's like there's a little bit of overlap, but
yeah. And also, it depends on your size too.
field.
If you're like a bigger person, do a certain type of stretch, and you're putting a lot of weight on certain parts of your body to kind of like give you the indirect effect, then yes, it would.
Do you want to do the tongue stretches again today?
Yeah, sure.
Because oh yeah, we're doing great on time. Hooray! So. Alright, we just can each grab a glove and a non-woven sterile gauze pad.
Do you want to do it on me for the video just for today? Would that be okay?
Yeah.
Or, okay. Yeah. All right.
Okay, so yeah, I think the most helpful way is if you experience doing it to yourself, me doing it to you, and you doing it to me, so you can feel all 3 ways. But we did that last time, right?
Yeah.
Okay, so first tongue out.
I want to do a little bit closer.
I promise this is a real thing. So just try to stick your tongue out and relax. I'm going to grab your tongue and gently pull. If it's too intense, put your hand up so I'll know to stop. Then give you a second. Swallow. And then we can do the next one I have listed is left and then right. I'll do my left or no, your left, I think. This way. So I'll pull out and over. Relaxing the tongue is so hard. I don't think you did these to me. I think we did the jaw one. You should do this one to me today. It is really weird to feel it on somebody else. I always like need a second to swallow between.
Yes, I'm good.
And then other side. It always reminds me of like picking up a slug, kind of.
It's a really weird feeling.
Yeah, it's very strange. And now the frenulum, the middle part of the tongue that like holds your tongue down, I'm going to try to put my fingers in and kind of like gently put my fingers on either side and hold, and then I'll lift up to stretch from the base of the tongue.
Okay.
Did I get it?
Mm-hmm.
Good. I feel like your frenulum is pretty, it doesn't stick out very far.
Mm-hmm.
It's a little hard to grab.
I have a shorter tongue.
Okay, and then want me to do the anterior TMJ stretch?
Yeah. The best part.
Yeah. So I'm going to, just to, in case I forgot to say anything last time or having it recorded is helpful, I'm going to slide my fingertip on the inside of your cheek and the outside of your gum. Between the two, I'm going to try to slide back to get towards the inside of the TMJ, and you keep your mouth open and relaxed, and I'm going to find like a little pocket back there, and then I'll say, okay, close your mouth, and you close your mouth, and your the jaw, the teeth, the gum in the cheek, it'll feel kind of like, it'll grip my finger kind of, and then I will slowly be trying to push a little farther back, and oh, if you need words, okay. I think I can pause this, actually. All right, okay. And I'll also try to turn my finger to the side so I get more space, and we'll see if it feels different than last week.
Okay.
Okay, close. Here, open again, actually. I think I'm not quite. Now close. One more time. I'm going to switch fingers. I think I can get this one in today. This one's longer. Am I hurting you? Okay, good. And close. I'd rather not do anything than do too much and it ends up hurting. Let me try the other side.
I can definitely feel it.
You can? Oh, good. Yeah, yours feels different than this side. I can feel. I remember yours felt very different on both sides. Yeah, now you can close. Oh, hold on to it one more time. Let me get back there. One more. No, don't close yet. Let me see. There. Okay, now try. Yeah, this side's much tighter. Which of course is normal. Like usually one side is worse than the other. Okay. Now let's switch and
So-
do you mind? Do you feel okay? Okay.
A little sore. But it's good.
Hopefully it won't be too sore.
That will be good.
So here, do my tongue, because I think that one is the one you didn't do last time.
Okay.
And feeling the
tongue going.
yeah, it's really an interesting sensation to feel somebody else's. I feel like it informs you for yourself in a different way than feeling me do it to you and doing it to yourself can do. So first straight out.
Learning how to do this.
Mm-hmm.
So first pull out. Okay, got good enough time.
Mm-hmm.
Okay.
If you can, when you do it, you don't have to redo it right now, but try to get like your thumb kind of more in the middle, because the right was stretching more than the left.
Gotcha.
But it's hard to tell on somebody else. But when you're doing it to yourself, I didn't think to say that before. So
Okay.
Mhm.
Next one. Your left. Let me know if I'm hurting you.
uh-uh.
Okay.
Good.
Good. Okay.
Mhm. I don't know if you could tell. I can like lean away to make the stretch more intense.
Right.
So and if
Okay.
you have somebody else do it to you, you can always do that too.
Gotcha.
It's
Alright.
harder to make it less intense though.
Last one. Okay.
Now try the frenulum one.
Okay.
That's the hardest one to get.
So.
Like,
Okay. Let me try.
Mm-hmm. 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 Great. That was really good.
Good.
How did it feel?
It feels interesting.
It's weird, isn't it? Oh, I should have taken my lipstick off first, probably. But
Oh,
okay.
lipstick.
Any questions or anything before
No, I
stop?
appreciate it.
Yeah, I hope it's helpful.